The world turned on its head as I seemed to defy gravity for a split second of time. Finally, I felt the hot road below me. My state of confusion dissipated. I felt secure. I turned my attention to the sound of cars whizzing by, the commotion of afternoon traffic, and then the vehicle that loomed before me. I had been hit by a car. The first thoughts that ran through my mind were, thank God I feel okay and that I can think okay, or at least I'm able to think that I can think okay. I remember the sound of friendly voices that checked my consciousness, the faces that reassured me, the doctors and nurses that came out from a nearby health clinic to examine me, the witnesses that waited, the driver that stayed, the paramedics that came. Oh, and yes, the bystander who kindly offered to refrigerate my groceries, which had flung across the road. Mild pain finally set in on the left side of my head, arm and leg in the ambulance. Stretched through the familiar white walls of an emergency department, the police finally caught up with us to collect further details. The driver will be charged with grievous bodily harm, they say. Tell him not to feel bad, and that I'm okay, I reply. In the hours that followed, I was attended to by ward clerks, nurses and doctors. Beeping machines filled in those times in between. Some have said it was a miracle for me to have walked out of the incident unscathed and discharged that very evening. I pondered in my own bed that night, running through the sequence of events. It was then that a couple of things struck me. Despite being drilled in our first week of med school about the importance of hand hygiene, looking back, I was amused that I couldn't rack my brains to recall whether or not anyone had done so, nor could I remember much about what was measured, what was said, what was scribbled down. What I remembered was the paramedic who stood by my side even though her shift had ended, and talked to me about her work with interest, though I knew she had probably been asked the question a million times over. The ward clerk who gave me a blanket. The consultant who took a chair and sat down by my side. The nurse who spoke on the phone with my family to reassure them that everything would be okay. What stayed with me was the person at the other end of my care, their mannerisms, their quirks, their humour. The eye contact they gave, the way they spoke, the way they approached. As William Osler once said, the good physician treats the disease, but the great physician treats the patient who has the disease. Indeed, as a patient, it was knowing that I was being treated as an individual that was most empowering. And yes, that age-old saying that people don't always remember what you say or do, but they will always remember how you made them feel, holds true too. The month leading up to the incident had seen my life change immensely, from East Coast to West Coast, from full-time work to full-time study, from having family and friends around to initially knowing no one. And all this to pursue this thing I called my passion, to practice the art of medicine. But that in itself has always been difficult to quantify, to palpate, to conceptualize. What exactly is providing good patient care? Every patient is different. It's nuanced. But giving thought to how the patient feels is a good start, and I've learned that it really is the little things, the non-technical things, that goes a long way. Medicine will no doubt be challenging, continuous, never-ending, but I feel extremely privileged to be on this journey, to find fulfillment in caring for patients. Oh, and in case you're wondering, I did get my bag of groceries back. Let's just say the plums and capsicums didn't fare as well as I did.